Welcome to HealthWatch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today we will meet two providers new to Novant Health. Physician Assistant Rosa of Novant Health Neurology and Nurse Practitioner Shannon Mathis at Novant Health Gastroenterology, and also Sheila Roberts of New Hope Clinic. Stay tuned to learn about valuable health topics with HealthWatch. First, let's welcome Physician Assistant Rosa of Novant Health Neurology. Rosa, we're so glad to have you here today.
Thank you. It's a pleasure to be here with you.
Good. Well, I want to start by learning more about you and your background. So talk to me about how you became a nurse practitioner.
Well, I'm originally from Puerto Rico, and I moved to Michigan after falling in love with a Michigander who worked with Ford Motor Company, and we were relocated there. Then I started to pursue my career in nursing and completed a bachelor's degree at the University of Detroit Mercy, continued education, got a master in adult chronic condition until I met my goal, which was to get a doctorate degree in nursing practice with a certificate of health education. My passion is patient care and education.
And it's very obvious. When you talk about patients, you just light up. So, do you have any particular focus in as a nurse practitioner? What is your particular focus?
Well, let me share with you a story about how I got my passion for neurology. And it was after I finished my master's degree and my certificate in nurse practitioner. I started working at Pontiac Osteopathic Hospital in Michigan as a neurotrauma nurse practitioner.
Wow. And
I have the opportunity to take care of a 16-year-old, very sad story, but very, very, very touchable in my life. She was celebrating her 16th birthday, went down the stair. She fell and had a brain injury. I was able to take care of her in ICU as a nurse practitioner. And then the mother approached me crying and saying, what is going to happen? And the only words that I can say to her was, I'll be there with her until the end. And believe it or not, we were together during each day at ICU. We were together when we had to make the hard decision of removing the life support. We were together when they decided to donate the organ, and we have a procurement procedure. And the last place was in her funeral. When the mother came and hugged me and said, Rosa, you told me you will be with her. I'm sorry, it gets so emotional, until the end. And it was a beautiful, beautiful opportunity that guided me to where I am right now.
So I would say your focus is giving great patient care and sticking in there with your patients.
And the family.
And helping, and the family, and helping them get through times like that.
Yes.
Well, that's a wonderful story, and it's so obvious how passionate you are about great patient care. So how do you come from Michigan to Brunswick County? Why did you move all that after that many years?
Well, I was there for 31 years, but it was time to move close to home. And for me, North Carolina, the weather made me feel like Puerto Rico, the ocean view, and the people.
Right.
So this was as close I can get to home.
That's great. Well, I understand that you're with Novant Health, or Novant Health Neurology. And so tell me a little bit more about the practice.
Yes, I have the opportunity to start practicing at Novant Health with Dr. Michael Applegate. He's the lead.
That's a long.
Yes, he's a lead neurologist in our clinic. Mm-hmm. We provide services to patients and also, as I say, the family with brain or nervous system disorders, such as seizures, migraine, multiple sclerosis, Parkinson, dementia.
Wow.
Yes, a lot of other musculoskeletal disorders.
Right. Wow, that's you do a lot. I didn't realize there were so many different disorders that were associated with neurologists.
Yes.
So how long have you been here?
Well, I just relocated with my husband after he retired, a week after the hurricane. Can you believe that?
Oh my, so you've been here since Florence.
Since Florence, but it's been a wonderful opportunity.
Yeah, and so what do you find that's most exciting about working here in Brunswick County?
Because Spanish is my first language, I think so there's a great opportunity for me to reach the community, the Spanish-speaking community, and also the English-speaking community, both, because I can provide them my services, provide the care in both languages, which is very important for me. It's a professional and a personal goal for me.
And I think that being bilingual, you will be very successful, but I think you'll be much sought after. I think people will be calling you saying, hey, can you translate for this patient for me?
Oh, yes, no problem. I remember, in Michigan, I also work with the organ donation association. I translate their consent for operation and other booklets to help them in Spanish.
Yeah. Well, can you tell our viewers how they might contact you for an appointment?
Yes, the office is located at 204 Smith Avenue in Charlotte. We open Monday to Friday. And if you want to know more, please feel free to call us at 910-721-4220. We are happy to help you.
Great. Well, it's been a pleasure having you here today, Rosa, and I look forward to working with you. I find your history very interesting, and I want to hear more about Costa Rica or Puerto Rico. Thank you so much,
Thank you
Rosa.
for the opportunity.
Now, let's welcome Shannon Mathis of Novant Health Gastroenterology. Shannon, thank you so much for joining our show today. It's a pleasure to have you here.
I'm happy to be here.
Great. So we want to start, as we do all of our interviews, by learning about our guest, a little bit about their education and their background. So tell us about that.
I went to nursing school at Barton College in Wilson, North Carolina.
North Carolina? Really?
Small private school. Worked for nurses for about 5 years at the bedside in a variety of areas, med surg, a little bit of orthopedics, some women's health, plastic surgery, before deciding to go back to school to become a nurse practitioner. And I got my master's in nursing through the University of South Alabama in Mobile.
Nice. So did you always want to be a nurse practitioner, or was that something that you just sort of grew into?
I really love taking care of patients, and in the acute care setting at the bedside, you take care of them for a much shorter time frame. And so I really enjoy having that relationship with my patients and being able to follow up with them and see them through. And so that is really what pushed me to further my education and become a nurse practitioner, to allow me to have that deeper connection with my patients.
That's awesome. Well, you do have a lot of experience, and you've already told me how you lean toward the nurse practitioner. So you've recently joined Novant Health Gastroenterology, correct?
Yes, ma'am.
So what interested you in that specialty?
I think the GI specialty touches a lot of people, whether they realize it or not. From day to day, I think at some point or another we've all had a GI issue.
Of course.
Unfortunately.
We don't like to talk about it, but
right,
we all
it's not
have
always the most fun, but I think, of course some people have worse issues than others, and quality of life associated with those issues can really be affected. And I think gastroenterology allows you to help people improve the quality of their life in that manner, at least, it makes a big difference for those folks.
That's true. I never thought about it like that, but you're absolutely true. Having been there myself several times, I truly get what you're saying, and it makes a big difference.
It really does.
To be healthy in that.
Right.
Aspect.
Even, you know, something as simple as heartburn, you know, someone that suffers from heartburn on a daily basis.
You can't eat what you really love.
Right. So, you know, it may seem simple to some, but for others it has a big impact on their life.
Right. And medicine only goes so far, and then you have to start looking elsewhere. But so you're in the clinic there at Novant Health Gastroenterology, and so tell me a little bit about that clinic and your role at the clinic.
So typically when I say we, there are other, another nurse practitioner and PA and our doctors, of course. We see patients in the clinic, of course, from screening colonoscopies to patients with gastrointestinal complaints, from GERD to, you know, abdominal pain, a wide variety of things. But recently we've also had myself and our other nurse practitioner and PA have started rounding in the hospital on our inpatients population as well. So we're getting to see a wider variety of things and being able to provide care for our patients in both settings. As I'm sure you know, we have the endoscopy center attached to the office as well. So our screening colonoscopies and our endoscopies patients are right next door most of the time having their procedures done. So we kind of try to keep them in the same place so that, you know, they feel comfortable and at home and know who they're working with.
Well, that's really exciting that you're seeing patients in the hospital. I think that's awesome, because oftentimes those types of patients end up being in the hospital after having been treated in your office at some point. So you already have that relationship, and then for you to follow up with them in the hospital, I think that makes a world of difference.
Definitely.
And it eases their
anxiety. I think they're familiar, they're comfortable with us, or, you know, we may obtain new patients that way. Patients that have had an acute issue that we can follow and help them manage long term.
So as far as your role in the clinic, then do you see like a lot of the new patients that come in like prior to their scoping?
We do. I do right now a lot more so because I'm newer to the practice, of course. So we kind of try to ease in and see a lot of the newer patients, just get them established, you know, point them in the right direction, make sure they're getting what they need. So that does make up a majority of my patient population right now.
And in speaking about the clinic, where is the clinic located?
We are on Highway 17, just past Novant Brunswick Hospital. Our address is 13 Medical Campus Drive. We're kind of situated behind the pharmacy. There's a little strip in front of our office there.
There's a big medical building across the street from you. It's a Brunswick Medical Park.
I think so. So kind of tucked away.
Yeah, it is kind of tucked away back in there. And so your office is right next to your endoscopy center.
Yes, ma'am. We're physically attached.
And that endoscopy center is something new to Brunswick County. It's been there about a year.
Yes, ma'am.
But it's a very pleasant experience to go there rather than to the hospital for a scope.
I think it's a lot less intimidating than having to go to the hospital for patients. You know, and we have a great team over there, from anesthesia to nursing staff, our physicians, everyone works very, very well together.
Yeah, I actually have had the opportunity to visit the endoscopy center.
Good.
And so I know firsthand about how it just feels much better. It is a great, it's a great facility, and everyone who works there is just very nice and friendly, and it just feels different than the hospital. So I think people will appreciate that more. So tell me, do you have any special medical interests other than gastroenterology, of course?
I'm really enjoying learning a lot more about irritable bowel syndrome, inflammatory bowel disease. Again, because those types of problems really impact quality of life for our patients, and being able to help those patients ensure and manage those symptoms so that they can live their best life is really fulfilling. You know, they're very appreciative, and you know, it may be something they've dealt with lifelong that they've never had addressed, or they just thought that's the way that it was, and it doesn't have to be that way. So I'm really enjoying that aspect.
That's great. So what is your favorite part of your job?
My patients, for sure. All of our patients. I really enjoy interacting with them, developing that relationship, building that rapport and being able to follow up with them.
Sometimes your gastroenterologist, you will see them as often as you see your primary care.
Sometimes.
If you have those such situations. So I think it's important, relationships are important.
Oh, yes.
And because it's a very intimate kind of exam.
It is.
And so you have to be really comfortable and trust your
I agree.
provider.
I agree, and I
for
think
those services.
I think if patients are comfortable with their provider, they are more apt to open up and really, share their experiences and allow us to help them the best that we can.
Yeah, oftentimes people don't tell you the truth.
Unfortunately, or it's embarrassing, or
right. It's just not an easy conversation.
It's not always.
Well, we're really happy to have you here in the community. How are you enjoying the area so far?
I actually moved to the area a few years ago.
Oh.
I grew up in North Carolina, so
that's true.
Being on the coast is newer to me.
Sure.
But of course, that is a plus. Love that. I grew up kind of in the middle of nowhere, not much to do. So it's been a very nice change.
Well, the people of Wilson won't appreciate that.
But it's been very, very nice to be out here on the coast, for sure.
That's awesome, and we're really happy to have you here. So if our viewers need to get in touch with you or need to make an appointment at Novant Health Gastroenterology, how might they do that?
They could either check the website, of course, novanthealth.org, and request an appointment online, or our direct number is 910-754-5988. Referrals from their primary care providers will also facilitate appointments for them. So there's a number of ways that they could reach out and get set up.
Is a referral necessary?
No, ma'am. Not necessary at all.
I wanted to get that out there because I didn't think so. Well, it is a pleasure to have you. I hope you'll come back and let us know how things are going for you.
I would love to do that.
We're happy to have you in the community.
Thank you. I'm happy to be here.
Finally, Sheila Roberts of New Hope Clinic will join us to share a bit about the clinic services as well as their upcoming events. Sheila, welcome back to the show. It's been a while since I've seen you.
It has been. Thanks for having me here again.
You're quite welcome. Well, there may be some viewers out there who aren't familiar yet, but why don't you tell us a little bit about the New Hope Clinic?
I'd love to. That's why we're here. New Hope Clinic is an independent 501c3 nonprofit organization. We're not just a nonprofit organization, we're a clinic. We have 2 clinic locations, one in Boiling Spring Lakes and one in Charlotte, where we're providing medical, dental, and pharmacy services for low-income, uninsured adults.
And Sheila, what is your role at the clinic?
I am fortunate enough to be the executive director. I've been there almost 11 years.
Wow.
Yeah. It's a wonderful place to be. I get to make sure we try to have the right resources for our providers, it's a caring environment for our patients, and that our community knows about us.
Yes. So let's start at the beginning. Tell me about your mission and your history.
Well, the clinic was started because some local individuals, including doctors, realized that low-income uninsured adults were not able to access health care anywhere other than the emergency room. Unfortunately, that situation still exists. There are people falling through the cracks in our healthcare system who don't qualify for Medicare, Medicaid, or full VA medical, yet don't earn enough money to afford private health insurance or subsidies for health insurance. So it's a volunteer-driven organization. We have a small caring staff, but over 150 volunteers who keep us going.
Wow, that's some serious stuff. I think that last year you celebrated your 20th anniversary, is that correct?
We did. 20 years of caring.
20 years of caring.
Yeah, we rolled out a new logo, which hopefully represents what we're really doing.
And it's a nice logo, I like that.
Yeah, we're working together. It's not just about the doctor in the exam room, we're working together with our patients, our community partners, all for that lofty goal of a healthier community for everyone.
That's awesome. Well, I know that you have a couple events coming up, so let's talk about those. I think the first one is Go Jump in the Lake.
Yep. Are you ready?
I am.
Okay. Are you going to jump this year?
No. That'd be a no, Sheila.
Yeah, we've been partnering with the Southport Rotary Club. This will be the 11th annual Go Jump in the Lake. It's a 5K run walk and a 1.5 mile fun run. They both start and end at Spring Lake Park in Boiling Spring Lakes. It's the Saturday of Labor Day weekend.
It's always that Saturday, right?
It is this year. That's August 31st. We start at 9 a.m. So it's a great opportunity to get everyone out and moving. 5K, there's some Couch to 5K programs, or Walk It, or Walk the 1.5 mile. We are always trying to create opportunities for wellness in our community. So this is another great partnership with the Southport Rotary, get people out moving, and even if you're not the fastest person, there might be a chance for a prize. The finish line is right at the edge of Spring Lake. And yes, there is water in the lake. There's water in the lake. We always get that question. Boiling Spring Lakes was hit hard last year.
Very hard during Florence.
Yeah, so we had to rearrange some things for this event, but there is water there, and our finish line will still be right at the edge of it. So we give out a prize for the best splash for an adult and for a child. So that's trying to create a fun atmosphere. It's not just about sweating and running around. But
that's a good weekend to have it.
Yeah. We have some great sponsors, including Novant, thank you, for the event. And they'll set up there so you can learn more about the community that way and working together with our healthcare partners.
Yeah. I know that you partner with several people in our community, and I understand that you have a partnership, as Novant does, with the Brunswick Wellness Coalition.
Yes.
Tell me a little bit about that.
So the coalition has been growing over the last couple of years, working to make Brunswick County the healthiest county in North Carolina.
Go!
Absolutely.
Go Brunswick County.
It's looking beyond healthcare. It's looking at wellness. So we have a lot of healthcare partners, but also community organizations like food pantries, looking at housing, ways to bring wellness to our entire community, address some disparities.
Yeah, I noticed they had a walk with a doc for the last 2 months, and so hopefully that'll take off too.
Yeah, we started that. It's the second Saturday of each month at the Boiling Spring Lakes Community Center. A healthcare professional, we have a short walk and then goes out and walks with anyone who shows up. You get a t-shirt. If you come 3 times, you get a pedometer, and we're hoping to replicate that in other areas of the county. We also are doing a healthy giving campaign with the food pantries. We want to make sure that we're not just feeding bellies, but we're providing nutrition. So looking at ways to work with churches as well to bring good food for those church dinners and just create a whole culture of wellness.
I notice when people donate food, sometimes they donate a lot of pasta, things like that, macaroni and cheese, and we have to figure out better ways of donating healthier options.
Right.
So.
We have high occurrences of obesity and diabetes in our community, and it's growing.
Right.
So healthier food options and access to exercise that's affordable and safe is very important for us. So that helps our patients as well as everyone.
That's right. It helps everybody.
Yeah.
So we've talked with about Go Jump in the Lake. So how about the next one that's coming up later in the fall? I think it's Art with Heart.
Yep, we hold Art with Heart every other year.
Right.
We have a great artist community locally.
We do.
So we have paintings, sculptures, pottery that are donated to our organization, as well as some other items like golf packages, wine packages, and gift certificates. We'll be holding that on Sunday, October 20th at the Southport Community Building.
Oh, that's good.
So there's a lot of details about that, as well as Go Jump in the Lake on our website. Both of the events are successful because of our sponsorships and the donations that come in. That's how we keep the clinic going.
I know.
We are not federally funded organization. We get our funding from donations and grants and these fundraisers. So.
I know. Novant Health is proud to be a sponsor of both events, and we're proud to help out as much as we can with your patients. And I know that you guys appreciate that, as well as several other facilities around help you in terms of services and.
That's right.
And testing and what have you. So
we all do that together. We can't do everything for those without insurance in our community, but by working together we can do a lot more. And our patients are so appreciative too. It's wonderful to be in a place where people say thank you and you know you're making a difference.
Yeah. And all of the proceeds from your events raised goes to help the patients at New Hope Clinic. It goes to keep supporting their all the care that they're getting and
Correct.
medications and stuff like that.
Yeah, we have this great team of volunteers from our doctors, our dentists, our pharmacists, our nurses, our receptionists. We have people who data entry. And we can always use more volunteers.
That's right.
That's right. But we do need funds. We still have to pay an electric bill. We still have to follow all the same laws as the healthcare organization. We need to keep the building safe, providing medications. So we do.
Well, let's talk a little bit about the types of patients that primarily are served at New Hope Clinic. What do you see?
We see everyone. You don't know when someone is going to have a hard time in life. So it's our working poor in our community, people who may be holding down a couple jobs, caring for another family member, someone who's out of work short-term or long-term. Their health care often can make it difficult to hold down a job. So we try to keep people healthy enough so they can work when jobs are available, and to keep the emergency rooms open for true emergencies.
True. And we appreciate that.
Yeah, absolutely. Well, we all do. We need to be able to know that when you're urgently ill, you can go to the emergency room.
Exactly.
So
that's what it's for.
We're trying to help get more people to learn about New Hope Clinic, to know that go there. It's like a primary care doctor's office with some limitations, but we're trying to provide a caring environment, and it's great. Our staff, our volunteers are there because they care. They can spend more time with a patient who maybe hasn't been able to access health care in quite a while, to understand not just their health care needs, but their community needs. That's where some of those other partnerships come in with the housing and the food access, to provide connections to resources to get back on your feet.
All right. Yeah. Is any payment required at New Hope Clinic?
No. The services in our building are available free of charge, and we try to work with other healthcare organizations that will also see the patients for free or for a reduced cost. But a patient does need to qualify first.
Okay.
They come in either in person, or all of our forms are on our website, so they could fill those in and then submit those, and we can talk over the phone about the process. Someone must be a Brunswick County resident, an adult with no health insurance, and low or no income. So we'll need some documents to prove that, so that we can open up those doors to healthcare.
So how easy is it to start that process? What if there's a viewer out there who thinks they're a candidate for this? How do they go about that?
I encourage them to call us.
Okay.
The main phone number goes to our Boiling Spring Lakes location, and that helps both sites, and we can talk someone through that. There's also a section on our website for patients that talks through the application process, as well as the documents that we will need to be able to get those appointments scheduled.
Okay. And can you give us the phone number at the clinic?
Yep. The best way to call is 910-845-5333.
5333.
5333. Yep.
How about volunteers? Do you need volunteers?
We do. We do. We especially need volunteers to help check the patients in for the appointments. We need people to help speak to the community, maybe do an interview with you sometime, to go, as well as in our pharmacy, pharmacists. So whether you have a healthcare background or not, we find a way for someone who has a good heart, can pay attention to details. We'd love to have their help.
Great. And they can inquire about that by calling the 845-5333.
You got it. Or go on our website. There's a section on there for how to help, either by volunteering or by donating.
Awesome.
We do.
Well, it's been a pleasure, as always, to have you, and I look forward to both events. I'm excited. I'll be at both, hopefully. Maybe not in the water, but I'll be there.
That's right. Well, we just want to make sure as many people as possible know about our services. If they're not able to access medical, dental, or pharmacy services, to contact the clinic. We might not be the right answer, but we'll try to get someone connected, and these events help us further that mission.
Right. Well, thanks again for being here. I look forward to seeing you soon.
Thank you, June. Great to be here.
Thank you for tuning in to ATMC TV's HealthWatch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.com. Visit novonthealth.org for more information on Novant Health Brunswick Medical Center, local doctors, and general health information. Thanks again for joining us today. Be sure to join us next time for HealthWatch on ATMC TV.
This is ATMC TV, your community channel.